Ladies and gentlemen, I must introduce you to my presence in the region. I've spent the last 12 years in the GCC. We're looking for the components of market research that would dictate how you would adequately design your facility. There's two aspects to it. One, it may be a greenfield facility, or you may be going through a process of change. What I must say is there's no better benchmark than looking at research that has evolved in this region over the past 10 to 20 years. You need to consider who your stakeholders are. They would have a vested interest in the project and potential outcomes. They have specific expectations. Most stakeholders' expectations are a return on investment based on the capital that they would invest, but there are other many variables that would dictate why a stakeholder would invest in any business. Obviously, the competitive strategy is an important component of your feasibility study or your research, because if you don't have a strategy and you have a market share, what component of that market share can you win based on your competitive strategy? And I think a lot of hospitals are moving to the trends of being able to offer alternate health, like the new concepts of hospitality combined with healthcare, being able to offer alternate therapies. Those exist within the region today, and it's a growing industry in a sense. Do you offer services that no other competitor can actually provide? Do you offer a patient experience that's unsurpassed to anyone within your domain of practice? Or I've taken this excerpt from the Alpen report. I hope it's actually clear enough, but a brilliant report. As I've indicated, I've worked in the region for 12 years. I'm so satisfied to have come across this report, because these are indicators that I've seen for the first time published in December 2012 that highlights what is the pipeline in the GCC or the Middle East. It's been stated that the GCC's inpatient and outpatient healthcare services market will have a compound annual growth rate of 11.4% from the period 2010 to 2015. Look at the change from $25.6 billion US dollars to $43.8 billion. What does that actually mean? What are the other very important statistical data that comes out of this? Resources. It's been proven, or the statistical data indicate that firstly, when it comes to investment in a facility, that the governments are funding at least 70% of these hospital designs and builds, which means there needs to be more private sector involvement, and that's the current challenge we're faced with, because the funding is not always available. There are a lot of initiatives and projects that exist. The pipeline is increasing in the private sector, but as mentioned before, the return on that is a much longer trend. So what's the next step? You need a market feasibility study. You need to understand what are the variables that would dictate the success of you actually building a facility and sustaining the life of that. These are the variables that you look at, and you can ideally read through each of these, but you would look at the market demand. You would understand your funders and investors. What are their return on investment? Do they have a target market? Are they an acute care facility? Are they a multi-specialty facility? Do they need to be affiliated to a college? So all of those variables do contribute to how your success would be. And then some other market research pieces, looking at design pieces, patient-centered care. It's a new buzzword that exists, where the services move around the patient does not go to services in a sense. But I'm going to speak more to the aspect of standardizing your room, the concept of using a same-handed room versus a mirrored room. So the handed room, same-handed means the head walls are not shared, mirror image, the head walls are shared, the plumbing is shared. The important aspect to these rooms are, one, standardization and repetition seem to reduce errors and waste. It's been proven that when you use a same-handed room, the physician is forced to be on the right side of the patient. It's the continuous repetition of care improves patient safety in a sense, but the challenge is that these same-handed rooms are much more expensive than mirror image. It's a cost difference of $3,000 to $5,000 per room change. So considerations in terms of your design. A digital strategy is very important. We all want to go big bang. Big bang is not the best approach. I advocate phased. I've been doing this for the past 20 years. We have not had a successful big bang approach. Find what you need to operate with from a digital strategy perspective. Look at the solutions you need. Make sure that they interoperate. Make sure that they align to your e-health strategy of the region. That's fundamental. You don't want to have to do change and rework at a later stage. So consider all those variables that would impact your choice in technology. Hospitals that I've worked on have budgeted $200 million and $300 million for technology. It's pushed healthcare costs over the roof. So be careful. Ensure that your investment gives you the return that you want. You want to be enabled in a sense. Project management, one of my last two slides, just to make a very important comment. I can sell you a whole bunch of methodologies. The important part of project management is managing your resources, your time, and your budget. Important. A lot of hospitals are going soft-life. Why? Because they haven't planned properly. Because they're spending on resources that are sitting on the ground that are not qualified enough to actually build. A lot of hospitals bring in clinical staff way before the time. You need planning, project staff for a project phase. You bring clinical staff when you're going through a last 6 months of go live and you're ready to actually activate your operations. So what future hospitals actually look like? These are some of the aspects we aspire to be a state-of-the-art, world-class facility, offering an all-digital hospital, embedding Six Sigma concepts, patient safety-focused design elements, like we saw with the same-handed and mirror image rooms in a sense. So the design of your facility, yes, there's adequate market research out there. There's adequate experience and innovation to help you design, plan, build before you actually activate. Ladies and gentlemen, thank you for your time.
Shiraaz, really, this is very nice, thorough review for this very important topic. I'm a physician, by the way. Thank you for saying that we are the most difficult people to manage. And I'm involved in management, so I know how both sides are thinking. I agree with you that physicians are the most difficult people to be managed. So, are there strategies you suggest to deal with them being the most important stakeholders?
Yes.
in medical healthcare?
Correct. If we, for example, can I focus on the greenfield side, because I see a lot of challenges out there. Physicians are an expensive human resource. Most instances, the investment on the physician comes in at a very late stage, because one problem with working in a greenfield hospital is a lot of clinicians are required to do clinical care to keep up their certifications in a sense. So they don't want to go and work in a greenfield site because they need to work. A good mix or balance needs to be achieved where a clinician has the capability of continuing clinical care while being part of a project team in building a hospital. So one, early investment in a physician is very important. You would spend so much money in technology, $200 million, but you'd be scared to spend a physician because you're worried about the fact that there's variables about him not practicing. But that investment is critical. You need to bring him in early. He needs to be a champion in the project. He needs to have a vested interest.
Just have a quick question for you. You touched on the issues. Thank you. You touched on the issues of feasibility studies, obviously, and you spoke as well about from an investor's point of view. Are there any benchmarks in the region, whether by country or just regional, on cost per square foot, cost per square meter, cost per bed, for what would be considered various types of facilities? Is there something published or available?
That's a brilliant question, and that's one of the biggest challenges we have in the region. So what a lot of best-in-class hospitals are doing in the region is that they are doing what's called service-level reporting. So their business intelligence tool would provide a bunch of reports saying length of stay, cost for length of stay, number of inpatient admissions, outpatients, but it's on a very high level. The granularity has not as yet arrived in the region. What you are alluding to are things like patient-level costing, or we're looking at granular service-level reporting, or you're looking at costed care patient pathways. So those elements we have not looked at because we don't have the benchmarks established saying these are the patient-level costing elements. But if you want a true example, you could just look at the NHS. They've done an enormous amount of work around patient-level costing, service-level reporting, and costed care pathways. But I think we're at the bridge of getting there. Thank you, ladies and gentlemen.